I feel like we have a moral obligation as legislators, as government officials, to put public health first. And I'm hoping that the governor and other state leaders will do the right thing, shut down these non-essential spaces and businesses, and at the same time deliver those financial supports, emergency paid sick time, guaranteed housing stability. There shouldn't be any evictions during a pandemic, and provide supports to those small businesses so they can go ahead and allow us to get this public health emergency under control.
I appreciate the Commonwealth's response to the second surge by rolling back the reopening. It is not enough. Emphasizing personal responsibility is misleading as there are more societal issues at play, and it's discordant at best when indoor dining, gyms, movie theaters, and casinos are still open and available. Me, as a mother and as a Black physician, I strongly urge the governor to not use police to fill public health roles. It's more important to actually build and strengthen the public health community. This is a time when communities need to trust the administration. And with the backdrop of structural racism, this allowing police to fill public health roles will erode the trust among the community and lead to an increased chance for police violence. If our elected officials are serious about addressing health and social inequities, then they need to enact policies that protect our essential workers, who are primarily people of color. Thank you.
This is a system marked by deep inequities, and some places suffer more than others. Low-income communities, gateway cities, and other communities of color, and rural towns often face the biggest challenges. And this divide further drives the racial and economic inequities so clear in COVID outcomes. Simply put, local health departments need sustainable resources to hire staff to carry out their responsibilities consistently. But it's not just money. We need a system with uniform standards for all communities, and we've got to support communities to work together to meet those standards collaboratively. We simply can't do this 351 times over. The pandemic has shown us that inching forward toward a solution simply isn't acceptable any longer. There's too much on the line, and we just can't accept the status quo. There's a bill pending before the legislature, the SAFE 2.0 Act, that stands for Statewide Accelerated Public Health for Every Community. And we need the legislature to move on this bill right away. The time to properly fund and reform our local public health system is now, in order to ensure that every resident in every zip code benefits from the public health protections they need and that they deserve.
Insufficient. Nurses are exhausted and tired of being called heroes in this battle against the virus while being neglected and endangered by the failure of the state and federal government to mobilize the resources we need to fight this virus.
Representative Connolly and others worked hard to provide regular families the housing security that would reduce chronic stress health problems, such as higher rates of hypertension, diabetes, heart failure in Black and brown communities.
So in order for us to see a just recovery, our governor and leaders must act now to proactively reduce and control current unsafe working conditions.
Because while the responsibility of acting safely to contain this pandemic, it may be equally shared, the risk from this pandemic is not equally shared. For some people, contracting COVID-19 will mean being out of commission for a week. For far too many people with disabilities, it means significant risk of death. More than 2/3 of those killed by this pandemic in Massachusetts so far have been people with disabilities, both under and over 65, primarily in congregate settings, nursing homes, obviously, but also mental health facilities, group homes, prisons, other places where large numbers of people, primarily with disabilities, are concentrated. It found people with intellectual and developmental disabilities are 3 times more likely to die of COVID-19 than people who are in the general population, despite which people with intellectual and developmental disabilities are not presently at elevated priority for the vaccine. So our ask simply is that given that the infection rates are higher than they have been at any point in the pandemic, the safety measures need to be stronger than they have been at any point during the pandemic. Anything less than that would leave people with disabilities in this state at a frankly unconscionable level of risk. Some things are more important than economic growth.
And Governor Baker's repeated focus on the individual as the solution to controlling the pandemic and insisting that people need to stay home and not interact with others is really not going to curb infections, because there are many people who don't have a choice but to go to work every single day where they are exposed to COVID-19 and then bring it home to their family members. If there's one message that we can drive home, it is that the risk of infection with COVID-19 is structural. And so now when frontline workers' families can't eat if they don't work, employers are exploiting people's needs by ignoring safety. And so we need to make sure that we are improving and strengthening the protections that do exist for workplace. And because workplace infections are driving the pandemic in the state and disproportionate sickness and death among communities of color, that actually is institutional and structural racism. And so if our elected officials are serious, like they said, about protecting the health of Black and brown communities, then they need to put their policies where their mouth is and make sure that we really have policies that make it possible for families to protect themselves from COVID, to make sure that they have access to testing, access to treatment, are able to stay home from when they're sick, and that they have a home to stay in.
You know, back in March at the beginning of the pandemic, it was clear to me in my intensive care unit, clear to me when I saw the patient population that was there, that if you didn't think there were health inequities before that, it was in stark contrast that day. And that is structural racism. It is housing insecurity.
It's truly a moral question, what we're facing. And what are we living through right now? The most profound wealth and income inequality, which of course is completely tied up with structural racism and white supremacy. And the leaders in this state, including Governor Baker, their default position is that they do not think it would be possible to readjust or reallocate the distribution of wealth or the distribution of resources in our society. And because political leaders are unwilling to consider a readjustment of resources and a readjustment of wealth and how we choose to use our revenue, that means people of color are going to disproportionately, unfortunately, get ill and die. That means that low income, working class folks are unfortunately going to get ill and die and suffer the effects of COVID. We are making a fundamental choice to protect wealth and to protect inequality at the expense of Black lives, at the expense of people of color, at the expense of working class folks. And that is morally unacceptable. And that's why I stand here in solidarity with all of you and continue to raise these points in the legislature.
Rep. Connolly really summed it up well when he said that Governor Baker's policies are really putting wealth first and human life second. We can't allow corporations to profit off this pandemic while so many others are suffering.
I heard that the governor is going to be announcing some additional restrictions today at 1 p.m. to encourage people to look at that. The list I've seen really does represent a half step in the right direction and does not respond effectively to the calls that we've made together today. And we've seen the governor over and over again, basically every day, explain to us that he's following the science. And we see over and over how that's not true, in instance after instance, where the science points in one direction and the governor's policies go in another direction. So ask the governor today, using all of your communications channels, what is the science that supports these moves? And how do these moves address the real needs of people in our communities that are suffering?
There's two pandemics. There's a pandemic, in Roxbury, there's a pandemic in wealthier neighborhoods like Back Bay, and they're not the same. 1 in 2 Black families being at risk of eviction at this point due to the economic impact of COVID. 1 in 2 versus the overall rate, something around 13%. And it's Representative Connolly's, systemic legislation. That's the only way to address structural racism.
People with disabilities in this state, in this country, have been systematically marginalized for a long time. We've been systematically institutionalized for a long time and have spent decades arguing for community living. That it provided that institutions degraded the dignity of people with disabilities. They degraded the choice of people with disabilities. And it turns out now that they also endanger the lives of people with disabilities. Right. So I would just add, in the near term, we need policies to keep people in the community. We need an eviction moratorium to ensure that people can remain in their homes where they're safest. And coming out of this pandemic, we need a fundamental rethinking of our current system and a shift away from nursing homes and other congregate settings as the default option for members of our community.
Just to add that we are louder together.
It does not take an MD or a PhD to know that indoor dining is not safe. You put members from different households inside of an establishment and have them talk and breathe in the same space. That is a key way for the virus to spread. And so if we want to save our restaurants, don't send people in there. If you want, you tell people that it's their responsibility not to gather, but then you ask them to gather in restaurants.
Right.
The state is sending people mixed messages. And if we want to protect people's lives and protect our restaurants, then we fund the restaurants with an aid package to allow them to safely shut down. And we tell people that they should not be indoor dining with members outside of their own household.
This COVID-19 Housing Stability Act, it is not about pitting one group against another group. It is about saying we are going to provide support to renters, to homeowners, and to small landlords. And with the federal package that was just passed, we heard that there will be, I believe, on the order of $25 billion to support tenancies. That's a great reason for us to now move forward with the Housing Stability Act, knowing that hundreds of millions of dollars will be coming into Massachusetts to help guarantee housing stability.
Saying thank you for all of the work you're putting in. Thank you so much for taking the time today. And thank you for being so bold and strong and unapologetic and speaking the truth that is frankly being suppressed, that we're not hearing enough and that we need to hear even louder.